Dr. Naseem, if I can come to you first. Your country has made remarkable progress in public health. What are the three main achievements about MTDs?
Maldives has made great strides in protecting the population against neglected tropical diseases. I believe we have achieved all three targets set forth in the Global Leprosy Strategy from 2016 to 2020. Back in the 1980s, Maldives was actually classified as a high leprosy endemic country. However, this changed with the introduction of multi-drug therapy. As a result, we were able to eliminate leprosy as a public health burden by 1997. Our latest target is to ensure Maldives receives the zero leprosy status by 2030. We will do this by following the zero leprosy framework. Additionally, Maldives became the first country in the South and Southeast Asia region to receive certification for having successfully eliminated filariasis as a public health burden by 2016. Furthermore, a study conducted in 2018 revealed a low prevalence of soil-transmitted helminths amongst school children. We can actually contribute this to the improved sanitation, access to clean water, and other proper hygiene practices in the Maldives.
So what's your formula for success?
Our formula for success. Our formula for success must be created to island community involvement and support that they have given to these kind of projects in Maldives. Also, credit goes to the government of Maldives for being steadfast in guiding our communities on the path to successfully eliminating neglected tropical diseases by aligning the needs of Maldives to our international commitments. Our health agenda must remain the center of our sustainable development goals. We make our decisions based on evidence and create country-specific plans supported by health professionals. I believe with this strategy, we will move in the right direction to winning our battles against neglected tropical diseases and other similar communicable diseases. From the very beginning, the government's focus has been on eliminating diseases by outlining clear objectives, bringing about changes required within the system. This enables us to sustain the efforts in preventing reintroduction of neglected tropical diseases. I would also like to emphasize that we are committed to sustaining our efforts in controlling and preventing neglected tropical diseases. We do this by keeping in mind our past experiences and replicated strategies that proved successful. Having said that, we are geared towards control and prevention of arboviral diseases such as dengue, which contributes as one of the major diseases that is burdening this country today.
Okay, thank you so much, Dr. Naseem. Now, following on from what Naseem has just said, you could share further insights into what small island states have learned in the control and elimination of MTDs.
Vanuatu historically has had 7 endemic entities. 4 have been targeted for elimination. They are leprosy, lymphatic filariasis or LF, Yos and trachoma. And 3 are for control, dengue, scabies and intestinal helminths. Vanuatu has been working to tackle NDDs since 1997, starting with LF elimination program. And by 2016, we have successfully eliminated LF. And by 2019, we have achieved the target for eliminating trachoma. We have accelerating efforts to control and eliminate other remaining entities such as Yos, leprosy, and scabies.
And then how can these lessons be shared with other countries?
With these achievements, Vanuatu has shown to the global community that controlling and eliminating NDDs is achievable because of the following factors. Number one, a strong political commitment from the government. Secondly, a strong leadership within the ministry and effective coordination with other ministries such as WAS, livestock and education sectors for joint planning, implementation, monitoring and response towards and against such targets, shared targets. Close working relationships with donors and partners and the technical advice of WHO, including the WHO roadmap strategies and guidelines. Fourth, community leaders' commitment to ensure high treatment coverage during mass drug administration campaigns. Finally, dedication of health workers to monitor the situation related to NDDs and to treat the community.
Mm-hmm. And then, so what are some of the potential threats to sustaining achievement?
The sustainability of the program is always a challenge due to limited domestic resources, high cost, logistic cost due to the remoteness and of effective communities, shortage of health professionals, and the fact that we are dealing with multiple co-endemic entities and frequent natural disasters, now compounded by the economic hardship that has resulted from COVID-19. Nonetheless, the Ministry of Health has been making a commitment to establish and sustain the NDD position within our ministerial structure and allocated 1.6% of our budget to complete an unfinished business of controlling and eliminating all NDDs.
Now, Dr. Singh, let's move on to you. You have made elimination of NTDs a flagship program for your region. How do you see progress so far?
In 2014, the WHO Southeast Asia region identified 7, now 8 flagship priorities, one of which was finishing the task of eliminating NTDs and other diseases on the verge of elimination. Together, WHO and its member states and partners in the region have made tremendous progress, fundamentally changing the global NTD landscape. In 2016, India was declared yaws-free. Maldives and Sri Lanka eliminated lymphatic filariasis as a public health problem, which Thailand also achieved soon after. Bangladesh is now under post-MDA surveillance and is preparing a dossier for elimination. In 2019, Timor-Leste became the first country in the region to successfully implement the first round of the new triple drug therapy for lymphatic filariasis across the entire country. India expanded its initial implementation of triple drug therapy into 23 districts and has plans for more. In 2018, Nepal eliminated trachoma as a public health problem, which Myanmar achieved in 2020. All Kala-Azar endemic districts in Bangladesh have now achieved the elimination target, and India and Nepal are on the cusp of eliminating the disease. The region continues to make strong progress against leprosy, reflected in Maldives' ambition to achieve zero leprosy status. Indonesia has reduced the prevalence of schistosomiasis to very low levels. Visceral leishmaniasis, trachoma, and lymphatic filariasis have all been slated for elimination as a public health problem and yours for eradication. In pursuing our flagship priorities, the Global NTD Roadmap and the $3 billion and SDG targets, WHO and its partners continue to identify and leverage high-impact innovations, including the rollout of e-learning modules on leprosy management and the development of the same for LF morbidity management and disability prevention. The region's progress has indeed been immense, and we look forward to supporting our member states to not only sustain but also accelerate their many gains to achieve a healthier, more equitable region.
And, you know, inequality and how it plays out in health systems through to lack of safe, clean water is a huge consideration in health in general. So how has such progress contributed to addressing this in Southeast Asia?
NTDs typically affect the poorest and the most marginalized communities, entrenching a cycle of poverty and neglect that is harmful to health, well-being, and sustainable social and economic development. By targeting NTDs as a flagship priority, WHO and its member states and partners have helped break that cycle for millions of people across our region, reducing disabilities and increasing the chance for hitherto poor and marginalized populations to live healthy and productive lives. World Bank data show that 8 of the region's 11 countries are lower middle or low income countries. The region will continue to ensure that NTD diagnosis and treatment is completely free of cost and will continue to promote policies that help affected people avoid financial hardship, for example, through the provision of financial benefits. We will continue to promote policies and programs that secure stable livelihoods for people who have incurred NTD-related disabilities, and will continue to champion such policies within our elimination and eradication strategies. The SDGs underscore the fact that health is both an input and output of sustainable development, and call on us to ensure that no one is left behind. You can be certain of WHO's ongoing commitment to that outcome and to achieving our flagship priorities, the Global NTD Roadmap and the Triple Billion and SDG targets.
Thank you, Dr. Singh. Now, moving to you, Mohammed Al-Pate, neglected tropical diseases are deeply anchored in poverty. What is the World Bank's perspective on poverty-driven diseases?
The World Bank agrees wholeheartedly that neglected tropical diseases are anchored in poverty and lock people into a cycle of ill health, poor education, and lack of opportunities, positioning neglected tropical diseases, or NTDs, as a key threat for building a country's human capital and for progressing towards universal health coverage. Health is foundational investment in any country's human capital, and putting people at the center of the country's plan is the key to ending extreme poverty and creating more inclusive societies. NTDs have long-term consequences that can cause visual and physical impairments, leading to disabilities that place an overwhelming financial burden on households and the loss of productivity, which become a burden on national economies. This is in part due to the costs of seeking healthcare, which not only include out-of-pocket spending on consultations, laboratory work, and medicines, but also transportation costs and informal payments to providers.
Now, both the World Bank and WHO advocate for investment in primary healthcare. How is such an approach contributing to tackling these diseases?
We all know that primary healthcare is the cornerstone of high-quality health systems. And much of the World Bank's work has been focused on ensuring equity of access to essential health services, building robust health systems, and expanding financial protection for the poorest people in countries. Primary healthcare is the most cost-effective way to address comprehensive health needs in an equitable way. And this cannot be even any more important than with regards to neglected tropical diseases, since they affect the most vulnerable and marginalized and poorest people in our societies. It is for that reason that the World Bank has been promoting the integration of deworming in health packages for UHC to not only improve the health of the population, but to also ensure higher current and future productivity levels that are needed for human capital development. The World Bank has been very active since 1970s in reducing the burden of neglected tropical diseases and has committed over $160 million to date on a combination of national and regional programs that address neglected tropical diseases. Since 2015, our efforts are concentrated in supporting our client countries to increase sustainable domestic financing for deworming, to integrate deworming in UHC packages to strengthen their primary healthcare systems. This has led to annual bank investments from 2015 to 2019, signaling deworming as a best buy in development.
Thank you for that. And finally to you, Khaled, the Kuwait Fund has supported projects in so many different countries since the mid to late 80s. I'm talking about the guinea worm eradication program. What motivated you to fund NTDs, and how have you maintained the momentum over such a long period of time?
Thank you, Patricia. It is indeed an honor for me to attend the launch of Neglected Tropical Disease Roadmap for the years 2021-2030, a very important document for us all indeed. A document that will support the implementation of programs for the control, prevention, elimination, and eradication of NTDs globally. And we proudly congratulate WHO on their achievement during the previous roadmap for the years 2016-2020. And thank you also for providing this opportunity for me to say a few words about Kuwait Fund's involvement in this field. Kuwait Fund has been participating in the financing of disease control programs globally since 1974. As an active member of the donor community committed to fighting against onchocerciasis, as we recognized back then the importance of giving neglected tropical diseases the proper attention and support needed. As a relatively unknown issue to the public, and indeed at one point on an international scale, the Kuwait Fund recognized the importance of addressing such an important yet ignored plight. Our continued commitment to the issue can be noted via our historical involvement in this domain, as Kuwait Fund has attended every meeting concerning onchocerciasis to date. We also took a consulting role at the first roadmap for NTDs and hosted the first multi-donor conference in Kuwait in October 2017. Kuwait Fund is also one of the co-founders and early financiers of the expanded special program for the elimination of neglected tropical diseases, ESPIN. All that and our momentum within these endeavors over the years have been helped in no small part by our continued collaboration with various health programs and other implementing partners, a testament of our successful collaboration and committed dedication over the past 45 years. To name a few examples of such collaboration, Kuwait Fund has proudly supported the River Blindness Control Program in Africa, the Foundation for Tropical Diseases, the Worm Eradication Program, and the expanded special program for the elimination of neglected tropical diseases. Indeed, Patricia, Kuwait Fund has been steadfast in its support for disease control programs over the years. The main drive behind such involvement is certainly solidarity and the belief that it is our moral obligation to help those suffering from such preventable, horrible diseases. We are also driven by our principal desire to contribute to the betterment of people's lives and investing in their well-being. Furthermore, and as it is clear to us all, that healthy individuals make healthy and productive communities, and that health is a crucial element in the social and economic development of nations. And it is in this standpoint that Kuwait Fund, since its inception in 1961, has been intentionally focusing on improving the health conditions in our beneficiary countries by financing development projects that improve access to electricity, water and sanitation, health and education, and other crucial infrastructure. We are extremely proud of the achievements of the various well-run programs that have effectively sustained their activities over many years, as they have helped save millions of lives. We also would like to express our recognition and appreciation of the great strides taken collectively within the African continent towards fighting against neglected tropical diseases. I would like to seize this opportunity to highlight the importance of fighting NTDs through our continued concerted efforts and commitment. This partnership is an exemplary case of international cooperation for addressing not only health issues, but also development concerns as well. And I wish for our continued success in tackling and hopefully one day eradicating all neglected tropical diseases. Thank you for your kind attention.
Thank you so much. Thank you so much, Khalid. And of course, thank you to all our panelists for giving us all a glimpse of the lay of the land in their respective countries and regions.